Last year, one of the worst COVID-19 outbreaks in the nation took place at Canterbury Rehabilitation and Healthcare Center in the West End. Since then, many medical experts and public officials have cited the need for better staffing at nursing homes and how that could help prevent future outbreaks.
But nearly a year later, the staffing situation at Canterbury and many other facilities has not improved. Now, some think a new state law is necessary. CBS 6 problem solver Melissa Hipolit found that federal law does require Medicare and Medicaid certified nursing homes have a registered nurse on duty 8 hours a day, 7 days a week, a licensed nurse on duty 24 hours a day, and provide sufficient staff to maintain patient care. But Canterbury's former medical director, Dr. Jim Wright, says sufficient is not specific enough.
You can say that we have appropriate staffing to take care of our patients if you only have one aide for 20 patients, for example. There's nothing to prevent you from doing that. Instead of simply being a frustration, we have now realized that staffing shortages are essentially a death sentence for our elders in nursing homes.
A state study completed last year found that of the 286 nursing homes in Virginia certified by the federal government, 44% of them received a below average or much below average score on staffing levels. And two recent studies show that nursing homes with poor staffing levels were more vulnerable to the spread of COVID-19. This General Assembly session, Wright and others supported legislation that was sponsored by State Senator Jennifer Kiggans that would have imposed minimum staffing requirements at Virginia's nursing homes. But a subcommittee decided to send that off for further study.
Now, problem solver investigator Melissa Hipolit joins us live with new information on her investigation. Melissa, you mentioned some research studies in your piece related to staffing in nursing homes and COVID outbreaks. What did you learn from those studies?
Well, good morning, Reba and Rob. In one of those studies, they looked at nursing homes in 8 different states. And then in the other one, they just looked at nursing homes in the state of California. And in both of the studies, the researchers found that those nursing homes that had received excellent scores from the federal government when it came to staffing had fewer cases of COVID-19 during this pandemic. So they concluded that better staffing meant reduced spread of COVID in nursing homes.
Melissa, you found a third study that suggested there's something else that predicted which facilities might have these severe outbreaks.
Yeah, it's really interesting, Rob and Reba. The third study came from the University of Chicago, and in that study, they looked at nursing homes all across the United States, and they found that the top predictor of nursing homes that would have widespread of COVID-19 was community spread in the neighborhoods surrounding those nursing homes. However, those researchers still suggested that better staffing would lead to reduced spread of COVID in nursing homes.
Wow. Melissa, thanks for waking up with us this morning and sharing this information.
Yeah, it wasn't easy.
It is early. Thank you, Melissa.